Good afternoon, friends. You are most welcome to Thinkers channel. Today we are going to discuss practicing anthropology, MANI003, and in which we are going to discuss practicing anthropology and health, Unit 1, Health and Culture. Let us begin the topic. Our topic is traditional medicine. Traditional medicine, also referred to as folk medicine, ethnomedicine, or popular medicine, is primarily concerned with the study of various aspects of folk taxonomy of disease, indigenous preventive and curative measures, the role of folk medicine, man, and relationship between medicine and socio-cultural settings. Ethnomedicine system has its very root in the cultural settings and thus the whole workings of the of and the behavioral patterns relating to the healing practices are interwoven in the cultural matrix of the people. The systematic and integrated study of the system of the medicine pledges to unfold the total understanding of the socio-psycho-cultural interaction in the sphere of the public health and hygiene. The WHO defined traditional medicine in 1976 at the meeting of Brazzaville as the sum total of all knowledge and practices, whether explicable or not, used in diagnosis, prevention, and elimination of physical, mental, or social imbalance, and relying exclusively on practical experience and observations handed down from generation to generation verbally or in a writing. Cited in Medi et al. 2004. Medi is the writer. The indigenous patterns of receipts are the results of the close-set process of the orientation of cultural traditions with the religious sentiments, psychological perspectives, economy, moral ideas, and social values as well as therapeutic process. It is to be noted that this indigenous patterns of medicine is characterized by the age-old experience of on human body in relation to the surroundings, both natural and the supernatural traditional knowledge. Plurality in therapeutic and health-seeking behavior. The status, growth, and evolution of coexisting therapy systems are influenced by cultural ideology, ecology, political patronage, and changing social institutions. Allopathy, Ayurveda, homeopathy, and Unani are the various components of medical pluralism in the Indian context, which we called as Ayush Bhasin 1997. Any healthcare system, especially in the rural areas, exhibit the presence of various impinging factors which has resulted in the existence of plurality in their therapeutic and health seeking behavior. In view of the plurality of the treatment options, perception of medicine compatibility is based on the expectations of the patients who speculate the time period of achievements to complete cure after consuming the medicine. Reflection. Patients or clients ought not to be the object of our activity but the subject of our concern, and we must be concerned with how their experience of the world contributes to the problems which they present. To quote Ackernack 1945, there are a great variety of the ways of handling the sick person, ranging from the abandonment and con- contempt to extreme devotion and care. These attitudes, which are extremely revealing as to the general philosophy of the society of a society, can be quite competently observed without the acquisition of a diploma from a medical school. The existence of both traditional and modern medicine has resulted in the plurality of treatment options. The selection of the particular mode of the treatment is based on various socio-cultural dimensions that tend to influence the health-seeking behavior of a particular community or the cultural group. Culture and the health services. For practicing health professionals, it is timely to take it, it is timely to take pluralism or diversity into account to re-examine the important role culture plays in how people view and make decisions about their health. We all need periodically to re-examine our own culture, our own cultural and professional bias, and to be cognizant of the current diversity in the communities we serve. Manshaw, 1993. Clean Man 1980 has suggested that there are three overlapping sectors of healthcare that constitute the healthcare system of the all societies. His point is that although the content of these sectors differed across cultures, their structure is the same. Essentially, the healthcare system is structured into popular, folk, and professional sectors. Each of these sectors offer a particular approach to understanding the cause of and prescribing treatment for illness or disorder. The popular sector comprises of lay or non-professional who discuss about the ideas related to health and disease. Such ideas and in discussion, and they are never formulated or for planned action in the healthcare system. Quite in contrast, the professional sector comprising of organized health professionals mainly from the scientific medicine background has been successful in terms of setting the health agenda and making the medical profession superior to all other approaches to healthcare. The third sector, that is the folk sector, comprises of sacred and secular healers. This sector takes into consideration some aspect of popular and professional sectors. There are different approaches to ascertain the cultural sensitivity of health services. One approach is to conduct customer satisfaction surveys in order to learn whether the health needs to different cultural groups are fulfilled. The basic health concerns of the people should always be kept in mind in any kind of study on cultural sensitivity. We need to understand the cultural sensitivity of health services of a particular cultural group in relation to other cultural groups. That is, studies should be conducted in cross cultural perspective. Findings from such studies will definitely help planners and policymakers to formulate plans and programs for development of the health settings. Global health. Global health highlights the inseparable relationship between the health and culture. Global health recognizes the interconnectedness of the health problems and health solutions, acknowledges and acknowledges the broader social, political, and economic context that give rise to many health inequities, and recognizes the importance of developing strong and resilient health delivery systems. In contrast to narrowly focusing on individual treatment regimes, McLachlan 2006, this world is home to so many varied cultural groups and communities. As part of the multicultural world, we need to adopt a meaning centered approach and tolerate the widely different understanding of disease and disorder across cultures. Global health emphasize the global health emphasis on cooperative actions and solution of health problems, and this can be possible only when attempts are made to understand health problems transcending national boundaries. Here we need to understand the fact that all health problems across cultures and across national boundaries can be best dealt with collectively, and attempts are therefore made to facilitate easy accessibility of the health services. Global health acknowledges the that health will be affected in the same manner by similar factors across cultures and boundaries. Summary: a complete and exhaustive study of practicing anthropology necessitates an understanding of health and culture. The interrelationship between health and culture is truly complex and needs an understanding of a kaleidoscope of causes, experiences, expressions, and treatments for a plethora of human ailments. Culture, which is nothing but learned and shared human behavior, encompassing health behavior, deeply influences the understanding of health and medicine. In other words, culture is a principal determinant of personal health behaviors and professional practices of medicine. The concept of culture is therefore fundamental to comprehend the health condition of the human populations, thereby enabling us to cope and protect ourselves from diseases or infirmities by adopting preventive and curative methods as a means of adjusting to the interplay of varied physical and social environments. Health practices are therefore not independent of culture in any society, and socio-religious beliefs and practices have various health implications in the human societies. Culture bound syndromes, which reveals the presence of symptoms unique to a particular cultural groups or community, tends to affect the mental health of the sufferer. Besides mental aspects of health, the impact of the culture on physical health is also an important area of study in health and culture. It is important to mention that cultural differences and its impact on physical health does not imply that cultural variation is the sole cause for occurrence of all types of diseases. This is due to the fact that irrespective of the cultural group to which one belongs, we will find the occurrence of some diseases which are either genetically determined or acquired. The different perception that exist among different cultural groups regarding the functioning of the human body very clearly shows the interrelationship between health and culture. In this context, a particular cultural group will provide an explanation of the various physical, psychological, nutritional, and or spiritual influences which causes diseases and ultimately creates an imbalance of the human body. Health and culture thus plays an influential role on the multidimensional aspect of health of which treatment is an integral part. Medical anthropologists have important contribution to make to research, health service research and health communication. Medical anthropologists have important contribution to make to health service research and health communication by grounding investigations of resource supply and demand, accessibility and acceptability in the life worlds of local population. Anthropologists may help their public health colleagues better understand patterns of healthcare utilization and expenditure. The role of the medical anthropologist in health service research and health communication can be proactive, critical, and committed to community based problem solving. Nichter 1992. Global Health highlights the inseparable relationship between the health and culture. Practicing anthropologists can thus use their knowledge, skills, and facilitate change for the betterment of the health status of communities and people across cultural boundaries, and the interplay of cross cultural knowledge can play a vital role in assisting practicing anthropologists for research and action around the globe. Thank you very much.